Abnormally wide split-second sound. The normal physiological split-second sound can be accentuated by conditions that cause an abnormal delay in pulmonic valve closure. Such a delay may be due to increased volume in the right ventricle as compared with the left, atrial septal defect, or ventricular septal defect. Chronic right ventricular outflow obstruction, pulmonic stenosis, acute or chronic dilation of the right ventricle due to sudden rise in pulmonary artery pressure, pulmonary embolism, electrical delay or activation of the right ventricle, right bundle branch block, decreased elastic recoil of the pulmonary artery, idiopathic dilation of the pulmonary artery. The wide split has a duration of 40 to 50 milliseconds, compared to the normal physiologic split of 30 milliseconds. It is heard best at base left with the diaphragm. Listen to the following widely split second sound. The split will be taken out occasionally to allow you to compare the normal with the abnormal.